Next intervention was I had a patient who was previously on Mounjaro 12.5, and then their provider switched them to Zepbound, but they ended up putting them on the 5 milligram. So Mounjaro and Zepbound are both tirzepatide. They're both the exact same medication, just different brands, different indications. So I talked to that patient like, hey, your dose got docked down like twice because it comes as 2.55, 7.5, 10, 12.5, and 15. So their dose went down to basically 2 doses. So maybe the provider thought they were different drugs and was using the idea of incomplete cross tolerance. Cross tolerance is when you get, when a patient's tolerant on one medication and they're going to be tolerant to this, like another medication in the same drug class, but incomplete cross tolerance is they're not like fully tolerant to the medications within the same drug class. This is kind of like the term we use for opioids. Like when we change patients from opioid to opioid and they're tolerant on them, we'll usually decrease the dose by like 50%. But this was interesting. I told them basically their dose was chopped down. Last intervention was I had a patient picking up Vyzulta. It's a branded eye drop. It's relatively new. It's latanoprostene bunod. So it's basically a prodrug into 2 different drugs, basically latanoprost and then butane mononitrate. So 2 different mechanisms. It's used for glaucoma. It was $500 for this patient, and I don't believe she's trialed really anything else for her glaucoma, but she was paying out $500 like every single month. And I brought up, hey, maybe you could try latanoprost, which is usually first-line therapy. With glaucoma, it's $5 to $10 with a GoodRx, and it is one of the metabolites of Vyzulta. So I don't believe that there's a huge difference clinically between Vyzulta and latanoprost. Vyzulta is a little bit better, but we're still going to get that aqueous humor decrease with both of them. So this decrease in aqueous humor is due to increase in outflow, and then it also decreases intraocular pressure, which is what we need in glaucoma.